Two. All right. Just
Oh,
let me, I'll look at the little, everybody else ready? Everybody's muted. Okay. All right. Good afternoon and welcome to the Laguna Woods Democratic Club's December program. I'm Susan Deering, the current first vice president, and our president, Linda Nearing, couldn't be with us today, but she is with us in spirit. And today we have the good fortune of having Ernie Powell speak to us on the security and longevity of Social Security and Medicare, specifically how the changes in tax policies have negatively affected both those programs and what will have to be done in the future in order to secure their future. Ernie started his career working as a boycott organizer for the United Farm Workers. After working as a community organizer for affordable housing and the environment, he worked for AARP as well as for the National Committee to Preserve Social Security and Medicare. He is currently working for an organization called Social Security Works, and his focus for over 40 years has been on public policy issues relating to older Americans. He's a nationally recognized expert on grassroots organizing and campaigns. And we welcome today to Laguna Woods, to the Democratic Club, Ernie Powell. Thank you so much, Ernie.
Thank you, Susan. Well, number one, I wish I was there with you in person. I'm sort of used to Zoom, but it's so much better to be amongst real people. God knows the price we'll pay for all this social isolation, but God also knows the price we pay if we didn't do it because of the terrible virus that we're all facing. I want to just start it out with kind of a general remark, and that is that the discussion about the future of Social Security, the solvency of Social Security and Medicare is, I think, within the framework of what has been an overriding debate for many years. And that debate is essentially symbolized as though it were Ronald Reagan against Franklin Delano Roosevelt. In other words, what will government do? How will government be a safety net? How will government, should it just be what has traditionally been called laissez-faire, leave it alone? Or is social insurance going to be provided in a collective way where we develop earned benefits such as these programs, and then when we need them, we use them either for retirement or because we become disabled or a major breadwinner in the family dies or becomes injured. So that's the larger context to some extent of what we're looking at. What we've been watching what we've been watching and participating in for the last 4 years is a pretty tough fight. And it's been a tough fight that where the one side have sought to move wealth upwardly, and by doing and by depriving us of the kinds of programs that we depend on, us being older Americans and others who depend on the safety net of Social Security and Medicare and also Medicaid. The most egregious thing that happened is going to end soon when Joe Biden takes the White House. And that is that Trump attempted to essentially cancel the FICA tax. And the FICA tax is the 6.2% that is contributed into a fund, 6.2% by the employer, and the employee that's contributed in the fund to sustain Social Security, and then another 1.5% to sustain Medicare. His intention, and he actually made an executive order on this, was to essentially cancel it, give it back to employers and employees, and then when we started to talk about how we fund Social Security, it would go into the general budget just like anything else, and would not be a dedicated source to these programs that we both need, depend on, and love. The election will stop that. It will end that practice. If it had continued, Social Security, the trust fund itself, would be empty by 2023. If he had continued with this FICA tax cut, FICA, I'll be dramatic, act of theft, it would have been lights out and empty by 2023. Now, what was mentioned earlier is the tax bill, and I want to walk through certain elements of it. It was one of the biggest tax cuts in the history of our country. What I provided in email was a summary of it that was produced by Senator Bob Casey, who's on the Special Committee on Aging. He's a ranking member, and there's a number of features on it that was quite harmful to seniors. So the first sort of concrete policy narrative I'd like to give you is, what would that tax cut be about? Or what was it about? Because it passed in 2017 on a nonpartisan basis. Barely any Democrats voted for it. It would have eliminated any tax deduction vital to older Americans with high medical costs. So that would be out. It would eliminate, it eliminated an incentive for businesses to hire people with disabilities, including older Americans with disabilities. It threatened research into treatments for disproportionately benefit older Americans and people with disabilities. It makes it more costly for small businesses to hire people with disabilities, again, including older Americans. It reduces incentives for charitable giving to organizations that provide services for older Americans. It may result in older Americans and individuals with disabilities having to actually pay more taxes. And it could stifle investments in new facilities, homes, and especially in underserved communities. The massive tax cuts that are part of this plan, again, and it was signed into law by President Trump with the support of the Democratic side of both, Republican side of both the House and the Senate. Included the Republican tax plan increases the deficit by $1.5 trillion. It takes $1 trillion out of Medicaid and $470 billion out of Medicare. It did also do great harm to Social Security disability insurance, which comes out of Social Security funding. Now, one of the things that drives people to believe that that it's appropriate to do these kinds of changes is the fear that Social Security is going broke. And one of the best parts of my 20 years at AARP was being part of both the policy and the campaign management team representing California when we knew that that George Bush was going to attempt to privatize Social Security. So I'm going to jump for a minute from this tax plan that passed in 2017 to give you more context on the solvency issue with Social Security, because it all sort of winds itself together. So what we learned, and we did a series, and this was an exquisite set of facts that we found. What we did was we focused groups all over the country on the question of how people really feel about Social Security. And here's what we learned, and this is important to know. People believe in Social Security. They love it. They know that their parents or their grandparents or their own families have benefited from it. But the problem that they have with Social Security has to do with lack of confidence. So if you would walk out your door and go to a supermarket and talk to anybody, say 35 years old, and if you were to say to them, do you think you're going to get your Social Security when it's time to retire? They typically say no. And the lack of confidence has to do with the concerted attempt and effort on the part of conservatives to lower the lack of confidence in government. So if you don't have an efficient government, how do you protect the Social Security Trust Fund? So what we did at AARP in studying that is realize we couldn't just talk about the merits of the program. We realized through our focus groups that we had to deal with the confidence issue, and we had to actually concede and conceptually a little bit about what was being said and frankly what was being lied about. So we came up with the following message, and it was called the reality check message. Guess what? And I have it. I mean, it's so carved in my brain that I can say it without looking at a piece of paper. And it goes as follows. Guess what? Social Security is not perfect, but it's not broken either. In fact, it can pay full benefits. And at that time, again, we were working on this in the early 2000s. In that time, it could still pay benefits for another 20 years. And even at that point, it can still pay 75% of its promised benefits. So the point that I'm making is that that's still the situation, partially because of reforms that were done, partially because of how well it was designed. So Social Security does have a fiscal problem, but it's not for not in this case for another 20, 25 years. And even then it can pay 2/3 of promised benefits. So the reason why going into the trust fund, what's called the FICA tax, and some people say, who's Mr. or Miss FICA? It's not a person, it's a tax, that Trump was attempting to do, it would have bankrupted the system because it's like drawing out quickly as opposed to paying for the benefits and improving the program as you go. Other parts, so that's essentially tackling the sort of budget issue with Social Security with the underlying message. It ain't perfect, but it ain't broken either. And it can pay full benefits for better than 20 years. And even then it has a manageable deficit. Now, the tax plan that they passed in 2017, that the Republicans passed and the Trump signed into law, and then followed by what he was trying to do by essentially robbing the trust fund just literally 2 months ago, would have been an entire violation of, number one, our commitment to economic security and health security as well for all Americans. And it also, the other part that's interesting to me is that he wasn't, when Trump ran, and I know you remember these quotes. When Trump ran, he said he wasn't going to touch these programs. He said he was unlike any other Republican. I'm not touching Social Security. I'm not touching Medicare. And as soon as he had lunch with Speaker Ryan, when he arrived in Washington as the new president, his mind started to change. So that was a great disappointment, but it cost, but you know, we had to fight him, and we did, and luckily we prevailed this last November 3rd. So that's some contextual issues about solvency for Social Security and Medicare. We always have to be vigilant, okay? The retirement, it is not perfect, but it's not broken either. And one of the great parts about working for Social Security Works, which I've now done for about 4.5 years, is that the two people that started Social Security, and that is Nancy Altman and Eric Kingston, the founders of Social Security, not Social Security, Social Security Works, they were part of a committee in the 1980s that did a lot of the policy that passed. And it was a deal literally between Tip O'Neill and Ronald Reagan to shore up the Social Security Trust Fund. And that's why it's doing as well as it's doing. So I've learned so much more. I mean, I learned a lot at AARP, but be able to talk to Nancy, which I do once a week on our weekly staff calls on Monday mornings, you know, I've really learned a lot, and it's helped in the work that we're doing. and it's helped in what we can communicate to others. So I wanted to give you that contextual sense about solvency. It is, we always have to guard. We always have to watch it closely. But I'm absolutely certain that, in fact, our two U.S. senators are very solid on this. Feinstein's been good on protecting Social Security. So is Senator Harris, who is now Vice President-elect Harris, and Katie Porter has been just wonderful, as I'm sure you all know. The next part of the outline, should we ask for questions, Sue, or keep going?
I think you should just keep going, and then we'll have questions at the end. Okay?
Okay.
Thank you.
So for
Ernie.
many, many years, the older voter voted Republican. And I think that's a lot of that is sort of based on their history, the World War II generation, the Korean War generation, et cetera, et cetera. In some ways, Republicanism offered more stability, and Democrats, a lot were nervous they were too far left, but that changed. And that changed in this last election. The last time older voters voted for a Democrat by, in a majority way was during, was when they voted for Bill Clinton in his second term before Monica Lewinsky. And if we could ever sit down over a beer, I can tell you how Monica Lewinsky saved Social Security, but that's for another day. And that's a joke. Anyway, seniors, they still voted for Trump by much smaller margins. In 2016, they voted for Trump by a margin of 7%. In 2020, they voted for Trump by a margin of only 3%. And it does vary by regions. On the East Coast, it was 50-48 for Trump. In the Midwest, it was 54-44. The South, it was 54-45. And Biden, and on the West Coast, seniors voted for Biden by a margin of 50%. So we should be proud that we did the job that we did on the West Coast. In terms of racial breakdown, older senior adults voted for Trump by a margin of 56%. African-American older adults voted for Biden by 91%. Latinos, 65%. There was a lot of concern that Latinos in South Florida would lean towards Trump. And in fact, I think they did. I don't have the stats yet, but I think they did. And part of that was the sort of right wing, all those Democrats are going to turn you into a communist state sort of campaign monologue that was coming from the Trump campaign. So some people bought that. And so we didn't do so well in South Florida, but overall, still a majority of older Latinos voted for Mr. Biden, President-elect Biden. So given that outcome, given that we have a president-elect on the Democratic side and a vice president-elect on the Democratic side, what are some of his policy? What are some of Biden's policy aims? The first thing that if you look on the website is around RX affordability. 1 in 4 Americans have to give up at least one pharmaceutical because of their cost. Drugs are just way too expensive. When we won the prescription drug benefit, we meaning the fight we had to wage in 2001 under George Bush, we still had to leave some parts of it out with the idea, and again, I'm talking about Social Security, or excuse me, I'm talking about AARP because I was working with them in those days. We had to give in on a number of issues in order to get the bigger package to create prescription drugs covered by Medicare. We had to give in, excuse me, there's an airplane. We had to give in on what's called secretarial negotiations. That's where the Secretary of Health and Human Services negotiates prices for drugs. We just couldn't hammer that home. We had to give in on what's called RX reimportation, which actually was favored in those days by the deceased senator from Arizona, who was a good friend of Joe Biden's, and his name escapes me.
Okay.
Say again?
McCain.
McCain.
McCain, thank you. I apologize for that. He actually had a bill. It was a bipartisan bill for RX reimportation, but again, pharma was able to block that. Pharma is the pharmaceutical companies. Biden's plan will also remove certain tax breaks that they get for advertising, and it will also speed the use of what's called generic drugs, which are of course much more affordable than those with a label. The second thing he will do is protect. We're talking about the Biden policies. Protect on Medicare. Protect against pre-existing conditions. You know, we heard Trump talk about that a lot. He never once, he wanted to kill Obamacare, but he never once said what his plan was. And he used to say, he would say all the time, he wanted to remove any restrictions on pre-existing conditions. But we never saw the nuts and bolts of it. It's in the Biden plan. Number two, no lifetime limits for healthcare costs. So many insurance plans do that or have done that. And under the Biden plan for seniors, they will not do that. Stop on the question of age protections. The older you get, the more expensive your premiums are. And Biden plans to regulate that so that it's more fair and more equalized. And the final thing is, and we could do an entire Zoom call and discussion on this, is to help pay to ameliorate and end the tragedy in nursing homes. 60% of all nursing home costs are paid for by Medicaid. Some of it is paid for by Medicare. When that expires, then it's cost sharing. But a lot of and there's the term spend down. I'm sure you know what that term means. You have to spend down before you can get full coverage for Medicaid and nursing homes. 40% of all COVID deaths have been from nursing home. That's because there hasn't been enough resources for PPEs. That's literally the protective equipment that nurses and caregivers and people that work in the nursing homes have to use. One of the consulting gigs I've had in the last couple of years has been with the California Long-Term Care Ombudsman. We hired them, or they hired me, excuse me, to work the Brown administration when it was Jerry Brown, the second time it was Brown, to get the money back that Schwarzenegger had cut from the ombudsman program. The ombudsman are the people that walk into those nursing homes and look for problems, look for issues, listen to the residents, talk to the staff, and if there's a violation, they make sure it's taken care of. And if there isn't, and if that's not taken care of, they go to the Department of Health, and in some cases, they actually go to the sheriff to particularly if they find elder abuse in a nursing home. Hold on a second. Excuse me. So my point is that in talking about in the context of strengthening Medicare and Medicaid, Biden is going to be very serious about that because of the tragedy of all the deaths in nursing homes. The third part is his policies on Medicaid. It takes us back to long-term care. He's going to offer tax relief for up to $5,000, a tax credit for the cost of taking care of a loved one. Now, that's not enough. All of us know how difficult it is, particularly in the work-life balance, to take care of a loved one who needs care. We have a program in California called In-Home Supportive Services. It works pretty well. But even with that, it's very expensive to take care of somebody around the whole question of home care. Well, Joe Biden is going to open the door to making it easier, to taking the pressure off families, and his plan is to offer a $5,000 tax credit for caregiving. And again, beef up the protective equipment, the PPEs and other things that nursing homes need. Going back to my point about the ombudsman, they were brokenhearted, and they've been that way for months because they can't go into a nursing home. Now, it's for their best interest that they not go in because of the threat of a COVID spread. But the flip side of that is they had to watch all of this tragedy happen, and they couldn't go in and do their work. They were specifically excluded from doing their work. So hopefully, with more funding, with better attention paid to this crisis, nursing homes will improve. And you know, because, and it's key to the funding via Medicaid. Again, back to Social Security, we talked about solvency, et cetera, et cetera. In one of the links that I sent down, I gave you the link to an article that I wrote back in December, now a year ago almost. I had two friends in 1 week, one of them a colleague from AARP who wound up in a nursing home because of a stroke, and another friend who I used to party with I would party with her and her husband every New Year's Eve, and both of them just out of the blue had a stroke, and they wound up in a nursing home. Went from hospital to nursing home. The point being is that I have been very personally interested in the question of long-term care as a legislative issue. You may recall that during the Obama years, there was language about nursing home care and long-term care, but 2 years after they passed the language, he and Health and Human Services Director Kathleen Sebelius actually decided to remove it from Obamacare because they couldn't figure out a fiscal formula for it. That was a disappointment for me, although I really liked President Obama. But and having worked for the organizations I work for, long-term care has got to be much more front and center because it's a tragedy around how this has come. It's also very much a high priority for certain members of Congress right now, and also a high priority with my organization, Social Security Works. We will get co-sponsors if there is a nursing home bill. I don't want to say if, I want to say when there is a nursing home bill and a long-term care bill, whether it's through private insurance or a government program. As long as it works, it doesn't matter which one. So we've traveled from Social Security to Trump, to Biden, to long-term care, to solvency. We haven't covered the designated hitter rule in baseball. I think that's for another day. Sue, how we doing?
All right, we're doing very well, Ernie. Thank you so much for all that information. We do have a few questions, and one of the most basic questions comes from Maureen Mailer, and that is, how do we reverse the 2017 tax bill if we don't have control of the Senate?
Here's the formula I typically use when I talk to people who have a legislative question, particularly strong groups like yours, and I consider yours to be a very strong group, Laguna Woods. And I'm not just saying that. I mean, having worked down there a few times and stayed in touch with you, I consider you a very savvy group in terms of legislative issues and also organizing. So the formula is study what I've given you, study the tax plan, the summary that Senator Casey provided, okay? And then ask for meetings. You can either be with a staffer or face-to-face with your elected officials and literally go point by point. And don't do a meeting with just one of you. I'm not suggesting a big picket line either, but I'd say take 3, 4 people in, you know, that shows a cross-section of interests from your community, and lay it out, because no matter, even if there is, if the Senate stays under McConnell, there's always another election in 2 days, and we're going to want to have our firepower up in terms of being prepared for that. There's a term I learned from Cesar Chavez. Actually, Dolores Huerta thought of it. It's called si se puede. And si se puede means yes, it can be done. And I would take a delegation, learn the policy side first amongst yourselves, and I'm happy to help you with that. Take the tax plan as you see it from Senator Casey's office. It pretty much of that is still in the bill that I know of. I will shop around because we have Social Security Works has a lobbyist, and I'll ask on Monday morning how optimistic they are, if they know there's any authors, and take it in to see Katie or Senator Feinstein's office. I mean, it was pretty miraculous the day that we flipped. This was probably, we flipped on Social Security. She was willing to go along with much of the carve-out plan. And in one meeting with about 7 volunteers in her office, we flipped her. But it was her seeing the power of our passion and her seeing the power of our constituent base. So that's what I would recommend. Study it, get a delegation together, and if you have to meet with staff, then you have to. One of the things you would do in that meeting, if you do meet with staff, is to ask for the next meeting we want with the elected. Okay, so that's what I would recommend.
Okay, thank you very much. I don't think that we're going to have any trouble getting our senators and Katie Porter on board with any of this. You mentioned that this is Biden's plan for what he would like to do. How much of that can be done by executive order, and how much is going to have to go through the Congress?
Well, the executive order part, first of all, Trump was going to take money out of the Social Security FICA contribution by executive order. And in fact, I asked our lobbyist on one of our Monday calls if it could be stopped by litigation, and she said no, they can do it. So the first thing, again, and we can get a guarantee, but I'm pretty sure he'll do it. He will reverse the FICA tax cut, the FICA tax raid, not raise, raid, okay, by executive order, because that's how Trump started it to begin with. That executive order came from Trump probably about 2.5 months ago. And I see Joe Biden doing it day one. It's something we can ask, but it's also something you should run up the flagpole with your electeds, so that they are talking. I'm absolutely certain he can do that, because that's how Trump did it to begin with, and that's what made it so onerous for us. You know, we wanted everything in the world. We wanted every means in the world to fight it, and what was frustrating was that we saw the trending. We knew that Biden was going to do better with older voters than anybody since Bill Clinton. So what does Trump do? He did it unilaterally as an executive order. Well, we knew we were never going to get him because he'd already broke a ton of promises. Remember, he ran on not touching anything that impacted seniors, and literally, he meets with Speaker Ryan and starts talking with, and literally he changed his policy views. Either that or he lied to begin with. That's Bernie Sanders' theory. He was lying to begin with, but whatever it was. So the first order of business is to make sure that that's cleaned up. Other executive orders, I will ask next week. I don't think he can just put pre-existing conditions out there. I think that has to be done legislatively. In fact, the entire Obamacare legislation, he said he's going to have to redo it because not only the threat from the court, because of the litigation that, of course, started out of Texas a few years ago, but he knows he's going to have to reconstruct it. But these elements have to be in it. So I would say the first order of business in terms of executive actions would be on the payroll tax thievery. Excuse my bluntness.
Okay, thank you.
The other thing, let me add one more thing. I'm sorry. The other thing is that the stories that I've heard about nursing homes. I mean, they had inspectors going into nursing homes in Pasadena that had COVID. They had COVID-19, and there were inspectors going inside nursing homes to inspect them for COVID-19. I've got a friend who works at Cal State Los Angeles. He got COVID in July. All right. He isolated for 14 days. He's now been tested probably 3 or 4 times. He is now negative. He doesn't have it anymore. Okay, or it's not seeable or whatever it is. I mean, the problem with this is that we don't have the science down yet because Trump didn't pay attention to it when he heard about it. Okay, that's in Woodward's book. I'm sorry to preach. My point being that the second way that Biden can start to activate a lot of these great ideas is in nursing home care. If I were Biden, and in fact, this would be something I will run, and you should run through Katie Porter. If I were Biden, I would get the industry, the nursing home industry, into that office, into the White House on day 1, 2, 3, or 4, and say, you got to clean up. But if you don't clean up, we're going to clean you up. I mean, I've seen the power of the nursing home lobby. We had a bill under Schwarzenegger when I was with AARP. We got bipartisan support for it. They killed it. They killed it in committee. And I can even tell you the name of the lobbyist for the nursing home. Okay, who did that? Some of them are nice people. Some of them are caring. But this is something that by executive order, he could push them to do. Because it is an emergency. People are dying. Excuse my passion.
We love your passion, Ernie. That's why we invited you to speak to us. We have a question from Rebecca who wonders if in your AARP survey, you found that people might equate Social Security or Medicare with socialism.
I think we're too far along on that. I think, remember, I started this out by saying this is a discussion between the whole overarching theme is it's Reagan versus FDR. I think most of us, most older voters are beyond that. It's tragic that that's partially how Biden lost Florida with the South Florida Cubano vote, Cuban vote. I mean, they were probably being told that Fidel had risen from the grave and was out selling fajitas on Miami corners. And that's sarcasm, but the point is that I think that is done for the most part. Now, are there see, when I was a kid, drove my parents crazy. I used to watch William F. Buckley. I used to watch a smart person be a conservative. Okay, I'm dying to see one. I haven't seen one in years. I mean, you all know the quote from Grover Norquist, who's one of the conservative leaders in Washington. He wants to take government and shrink it down to the size where he can flop it into the bathtub and choke it to death. We just went through 4 years of that. So this is where citizen power has to replace that, and smart, good legislators have to replace that on both sides of the aisle. So no, I don't think that permeates in very many places.
That's good to know, Ernie. Thank you. We have another question from Jonathan Adler, who wonders if the $4 to $5 trillion that will have by March 2021 been added to the national debt, will that become a political obstacle in keeping Social Security solvent?
Well, number one, you remember that there are raises to the FICA tax that are done incrementally, incrementally in the bill that I didn't talk about. Let me get my notes out. It's called Social Security 2100 by Larson out of Connecticut. And in about a 10-year, maybe 20-year span, he increases the FICA tax by 7.4%. He takes it by 2043, so it's longer than that. Remember, Social Security is a pay-as-you-go tax. It is not coming out of the general fund. That's what Trump tried to do. Okay, that would have been just utterly the death of the program. But also remember that Social Security and Medicare comes out of a 1.5 FICA contribution. Under the Larson bill, he wants to take it to 7.4 in 2043. So it's in a secure place because it is a tax designed to be, as we say, pay as you go. But pay as you go doesn't tell the whole story, because remember, in the Tip O'Neill, Alan Greenspan negotiations that I mentioned a minute ago, remember I said that Nancy Altman and Eric Kingston, who founded Social Security Works, staffed that. They did a good job of planning for the future and putting an automatic surplus in Social Security. So know that now. Let me tell you the habit of many Republicans and many Grover Norquist fans. They have no problem with increasing the deficit so they could say later, well, we can't afford food stamps. We can't afford Meals on Wheels. We can't afford education. All I can say is, I don't think anybody on this Zoom call, if you own where you live or you own your home, nobody pulled whatever amount you paid for it out of their wallet and paid in cash. The government is used to borrowing to fix this fiscal mess that Trump has caused, that this virus has sadly caused. There may have to be some adjustments, but for Social Security and Medicare, I call them reasonably safe. And it's also a share of costs for Medicaid as well, which is nursing home care.
Okay, thank you very much. We had a question earlier from Janice asking about the FICA payments by employers that were suspended, and when and if they have to be paid back, and by whom.
Well, here was the dark side of it on Trump's part. I don't think he told very many employers that they had to pay it back eventually. It was like a loan almost. But I also don't think it went for it. Remember, the campaign started right after he got this idea. I don't know how many people participated. It was, quote, voluntary. So I don't think a substantial amount of money was collected nor left the trust fund, but it's something we can look up. it doesn't worry me because excuse me, it was about to, it was hobbling along to begin with. I mean, you know, if again, I've read a lot of books on Donald Trump and his conduct, everything from what his niece wrote to the book by Woodward, Carl Woodward from Woodward and from the Nixon days. He's not a very good manager of legislation and ideas. So not to say that he hasn't done great damage, particularly along the border, and particularly what he's done to small children who are in cages. But my point is that to some degree, his inefficiency has been our friend. No matter what, I guarantee you, and I can verify it, that Biden will reverse it and do it quickly.
Well, we like that you have so much confidence in Joe Biden and Kamala Harris as we do as well. And let's hope that we get the Senate back so that some of this legislation can get passed. We have another question from Jonathan Adler. Nursing homes are paid largely out of Medicaid. States must pay a share of that. Won't far-right governors of many states block that, just as they opted out of expanded Medicare under the ACA?
Oh, that's stupid.
Everybody okay on the camera dropped? Well, but yeah, that is a possibility, and that's a risk. Can you guys see me? Oh.
Yeah, we see you. We see you.
Okay, thank you. Yeah, that is a risk, but understand that political movements have momentum, and it's not just that Biden won by the highest margin ever. I think he's up to 60. I know he's up to over 75 million votes, but you don't win all your battles at once. And I'm confident that there's a lot of states that came close to voting for Joe Biden, and I include Florida as one of them. That there will be a lot of pressure on those Republican governors to do as little harm as possible, which is why it's important for senior groups all around the country and other groups. You know, this was the highest vote total of people that have never voted in their lives in the history of this country. I mean, it was amazing. You know, at first when I was beginning to feel like Biden was going to win, I'm talking about 3-4 months ago, it was because I think I read 16 different press accounts that said that the senior vote was moving toward the Democrats. I read 1 or 2 on millennials and younger people. So we've got a political movement on our hands, folks. And it is, you know, 2 steps forward, 1 step back. 3 steps forward, half a step back. And that is, we didn't get all the grape growers on the first round, but we sure got them later.
I'm glad that you have such confidence. We have another question. If you think that the stock market's gyrations starting last March and the right-wing calls for partially privatizing the Social Security fund, do you think that will go anywhere, or will it have any effect?
No, if it did, it would die on the House side. Period. And I don't, you know, yeah, was McConnell, did he win by on good margins? Yes, he did. But you know, he's one guy that doesn't like a lot of confusion. And to ignite seniors by going after the trust fund is just crazy politics. It ain't gonna happen. But it would give the Democrats another horse to ride, and and the progressive side would ride it hard. So no, pressure from Wall Street would be on other things. There's a great Woody Allen quote. He said, I can't die yet. I don't understand escrow. Well, in my case, I can't die yet. I don't understand Wall Street. I'm a little better than that, but I don't see it happening that way.
Okay, that's good. I have a little fun question. Bowser, John Bauman, works for Social Security Works and has done a lot of speaking and touring and playing his piano and doing his Bowser thing. And he came here to Laguna Woods when Katie Porter spoke to us before she was elected, before 2018. So would you just like to give us a brief update on how he is doing and what he has been doing lately? Thanks.
Well, I'm going to brag for a minute. I brought John to Social Security Works. What happened was that when I was with the National Committee to Preserve Social Security and Medicare, we did a meeting in the White House. It wasn't with Obama, but it was with his policy folks, including Gene Sperling, who was his chief economic advisor, and other folks. We brought about 70 members of that organization that I then worked for in Washington. And the White House invited John, and he and I just, the minute we met each other was just, we were friends for life. And we hung a lot, we spent a lot of time together in DC. I traveled with him up through Delaware and up actually to Philadelphia. I've lived in Philly, so that was a lot of fun for me. And then when I got back to California, after leaving the National Committee, I called him about 3-4 months later, and we renewed our friendship and said hello. It wasn't a friendship to renew, we just said hello since we were back, because his home is on the West Coast, not far from Santa Barbara. But the point that I'm making is that it was during a Nationals game in Washington. I had tickets there for a ball game, and I invited Alex Lawson, who's the executive director of Social Security Works, and also John, to go to the ballpark. And they sat together. The three of us sat together, and then they hit it off really well. And it turns out that within Social Security Works, there's two groups. There's the C4, which I work for, and then there's the PAC, the Political Action Committee, and he's president of our PAC. So he does the formal endorsements and those events. But we talk to each other every Monday morning, and I will send him your regards. And he's still doing all that.
Thank you. I think we have time for one last question. Seniors also need and benefit from IHSS, in-home supportive services, which you mentioned earlier. What do you think are the prospects for expanding it with federal support?
I don't know. I don't know. I know that they have a lot of standing in the Capitol, in the state Capitol. I know that they have a lot of standing with SEIU, which is the biggest union in California, 600,000 members. They have a lot of, again, when they came to LA many years ago, and my office was, I live on Wilshire Boulevard, and an AARP was across the street. That's why I moved here to a beautiful place called the Gaylord Apartments. I met them through a friend. I met the then organizer for IHSS, and we lobbied together to get them accepted by the county, and then they started to grow, and they now are recognized statewide. My guess is that because of the urgent needs of home care because home care is much more affordable and frankly safer than nursing homes right now. That there will be a lot of work by the Newsom administration to get more help and support for in-home supportive services for two reasons. It saves lives, number one, and number two, it creates a higher quality of life, and it would save dollars in the long term because they're a lot less costly than nursing homes. That's not to say that nursing homes don't have a very, very constructive role in our country and our society, but IHSS, which actually was inaugurated by Ronald Reagan. Don't know if you know that. Because he saw the costs of nursing homes. But it's had a great track record, and I think it'll get some support.
Okay, well, Ernie, we thank you very much for taking the time from your busy schedule. We thank you for the good work you are doing with Social Security Works for protecting Social Security, not only for us, but for our children and our grandchildren as well. We will try to be as confident and as optimistic as you are. But thank you for your good words also, that we will continue working as hard as we can to ensure that and to support the efforts of our wonderful Congress member, Katie Porter, and our California state senators. We don't know who the second one will be. We're all very pleased that
Who's the first one? Who's your assembly member? Who's your assembly member now?
Oh, for California?
Yeah, down in
For
the
California Assembly?
Yeah.
Connie Petrie Norris. Connie Petrie Norris, and she is terrific.
Okay.
And we just had Dave Min elected as our state senator.
Okay.
So that we have two good supporters of Laguna Woods and et cetera in California government. So we're and I'm sure that we will have a good new U.S. senator once Governor Newsom appoints somebody to replace Kamala Harris.
Well, thank you all.
So thank you.
Go ahead, please.
No, I was just going to say thank you very much for being here today, for joining us, for your expertise, for your good work. And thank you to everyone who joined us today on the Zoom call, and to Pat Leftwich for organizing the Zoom call for us. Thank you to all of you who are tuning in and watching this program. And we hope that it provided you with some useful information.
Thank you all. Bye-bye.
Thank you, everybody. Bye-bye.